I want to talk about mental illnesses today. You know, the stuff that causes people to shoot up movie theaters and schools and do crazy things. People coming back from the war zone, PTSD, people who suffer from bipolar disease and do these things. They're all under the care of psychologists and psychiatrists, of course. And I believe that these medical professionals, psychologists and psychiatrists, have known for years before the terrible event happened, the catastrophic event happened, that these people should have been institutionalized, but because they didn't want to give up the weekly check to an agency, they just held on. They wanted to try a different drug, double the dose, give 3 of them at the same time, and of course, many times this results in disaster. Well, mental disease, whether it's ADD, ADHD, autism, depression, manic depression, bipolar disease, which is PTSD when you're in uniform, schizophrenia, psychoses, anxiety attacks, panic attacks, these things are actually caused by nutritional deficiencies of the brain. The brain requires all 90 essential nutrients, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. And in every case, these people are malnourished, and oftentimes, I don't know what the percentage is, be high, it'd be certainly above 50%, maybe above 75% if you critically look at it, that all these people that have catastrophic mental diseases also have a gluten intolerance, because their ability to absorb nutrients, even if they're in the food, even if they're supplementing, is reduced as much as 85 to 90%. And so let's say you're only getting 10% of the nutrients you need. Okay, let's say you're only getting 10% of the nutrients you need, and you can only absorb 15% of that. What's 15% of 10%? You know, we're looking not very much. We're looking at 1.5%. And so and this is very, very scary. And so if you have a loved one that's in the war zone, I would certainly send them the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight, and send them a good food, bad food list, get them off all the bad foods, because the government doesn't send our military personnel any vitamins and minerals. The government just feeds them canned foods, dry foods, bottled food, bagged foods, and it's a mess when they come back. And so if you have somebody in a war zone, or even in the military not in a war zone, definitely want to make sure they're getting the 90 essential nutrients, okay, and they will be better off for it, and the community will be better off for it. Well, autism and ADD and ADHD back, in 1980 occurred at a rate of 1 in 250,000. By 1990, it was 1 in 25,000. By 2000, it was 1 in 2,500. And then 2005 was something like 1 in 1,200. 2009 is 1 in 285, and today it's 1 in 44. Well, if you look at the amount of money that a pediatric psychologist makes for one autistic patient, it's $2 million over a period of 5 years. So that could be one reason why the diagnosis of autism is going up, just simply because it's financially attractive to the doctor. But also, it's simply because the way we feed our kids. Experts are telling us our children will be the first generation that do not live as long as their parents in America. That's very, very scary. Well, not only is it going to shorten lifespans, but people are going to get more diseases younger, and people are getting, it used to be things like MS, multiple sclerosis, was a disease of middle age, 35 to 50 when it was diagnosed. Well, now 10-month-old kids are being diagnosed with MS, and they're dying at 2 years of age. There's something wrong with this picture. What is going on? Well, everything has changed. We've cut out the mineral supply by going to electricity instead of putting wood ashes in the gardens. We're not eating dairy products anymore because everybody says dairy products are bad because of cholesterol. Of course, we know that's not true. But the general public followed these very, very scary beliefs. And so we have this huge problem. So we want people to actually get a hold of the book Epigenetics, The Death of the Genetic Disease Transmission, the book Dead Doctors Don't Lie, the book Rare Earths Been Cures, and the book Leslie Doctor, and learn how to eat right, learn how to avoid all the bad foods, and learn how to supplement with the 90 essential nutrients. Again, 16 minerals, 16 vitamins, 12 amino acids, 3 fatty acids. It's going to support and promote healthy brain function. And, of course, this deals also with the dementias, Alzheimer's disease, vascular dementia, Korsakoff syndrome, Wernicke-Korsakoff syndrome, and B12 deficiency dementia. All these are nutritional deficiency diseases. Parkinson's disease, Huntington's disease, got to say the T and the G, Huntington's disease, and also you're looking at MS and Lou Gehrig's disease, ALS. All of these are nutritional deficiencies. A big part of that nutritional deficiency is a deficiency of cholesterol. So remember, our brain and spinal cord and all our nerves require all 90 essential nutrients. And you're in a fool's battle If you think you can be a vegetarian and just eat well and not get a supplement, you're in a fool's category. If you think you can live on soft drinks and hot dogs and deli meats and pizza and microwave popcorn and not supplement and have a perfectly normal brain and spinal cord and nerves, not going to happen. Right now, 20% of Americans are disabled. And of those 20% that are disabled, a high percentage are because of emotional and mental diseases, all of which are preventable, all of which are reversible. You have to appreciate that medicines do not take the place of nutrition to the brain. Don't forget the eggs, 6 or 8 eggs poached, soft-boiled, soft scrambled in butter. Make sure the brain gets some good nutrition. Don't forget the 90 essential nutrients, healthy brain and heart pack. And you'll be way, way ahead of the game. Remember, epigenetics, Dead Doctors Don't Lie, Rare Earth Cures, and Let's Play Doctor. And we'll be back with Dead Doctors Don't Lie after these messages.
Aromatherapy oils have been prized by ancient cultures for thousands of years. Longevity's ancient legacy, true aromatherapy, is no exception. Essential oils are the fragrant life essence from plants that are gently removed through the process of steam distillation or expression. Longevity's ancient legacy essential oils are of the purest concentrations from the most respected and ethical distillers worldwide. Many of Ancient Legacy's oils come directly from families in the East, which have been distilling essential oils for over 100 years. These oils have been handled in a fashion designed to protect the integrity of the essence, to allow for effective use in restoring balance to the physical, emotional, mental, and spiritual nature of each customer. To learn more about aromatherapy and essential oils, contact your local Longevity associate today. And don't forget to ask about business opportunities.
Numerous studies have shown the link between the intake of antioxidants and disease prevention. Foods and supplements are measured in an ORAC scale. ORAC is an acronym for Oxygen Radical Absorption Capacity. In other words, the ability to remove disease-causing free radicals from the human body. Longevity's Cell Shield RTQ has an ORAC value of 15,800 points per serving. Cell Shield RTQ contains resveratrol, known as an anti-aging compound, turmeric, known for promoting healthy digestion, brain function, immune system, and cellular longevity. Quercetin, a flavonoid, is known for promoting healthy blood sugar metabolism and healthy lung and cardiovascular function. Remove free radicals from your body with Cell Shield RTQ from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate. And don't forget to ask about home-based business opportunities.
When you perspire, working or playing, your body is losing more than just water. That's why it tastes salty. But what you're sweating out is more than just salt and potassium, as some sports drinks will have you believe. One of the most well-known sports drinks only has 2 nutrients, and it's loaded with sugar. Some have a mineral or 2 with a couple of vitamins. Longevity's exceptional sports drink, Rebound FX, is chock full of cancer-fighting antioxidants, a full spectrum of vitamins, plant-derived minerals, and herbs. Rebound FX is a highly absorbable liquid supplement that gives you quick, sustained energy. Rebound FX supports cardiovascular health, immune health, and boosts stamina and energy. Don't short yourself during and after your workout with just a couple of nutrients. Drink Longevity's Rebound FX for optimal health. If you'd like to learn more about nutritional supplementation, call your local Longevity associate. And don't forget to ask about home-based business opportunities.
Through his research as a veterinarian, Dr. Joel Wallach discovered that most health problems afflicting livestock can be prevented and even reversed. Many of these same health challenges also occur in humans. These too can be prevented and reversed. Doc's original formula, called the pig arthritis formula, alleviated all arthritis symptoms in animals. The same basic formula has been developed for humans, called the Pig Pack, which includes plant-derived minerals, a multiple vitamin complex, glucogel, and EFAs. Add to that Longevity's OsteoFX Plus, a proprietary blend of liquid calcium, magnesium, and glucosamine. Now you have the Pig Pack Plus to make up the 90 essential nutrients Dr. Wallach has identified as necessary for sustained good health and longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Okay, Doug, what pearls of wisdom do you have for us today?
Well, this one's about doctors behaving badly. This is a Fox News story headlined, Medical Journal Essay Exposes Doctors' Inappropriate Behavior. It's two accounts of doctors behaving inappropriately and the patients with patients under anesthesia. These accounts expose the dark underbelly of medicine, according to those who wrote this in the journal Annals of Internal Medicine. And in the essay, the anonymous author described one day when he was teaching a medical humanities class to medical students. He asked the class, do you have someone to forgive from your clinical experiences? Did you anything ever happen that you need to forgive or perhaps still can't forgive? One medical student, David, spoke up saying that something had happened to him that he couldn't forgive. He said he was helping with a vaginal hysterectomy and the surgery, which a woman's uterus was removed from the vagina. Before the surgery began, the surgeon cleaned and anesthetized the area of the inner thighs, and then the surgeon said, "I'll bet she's enjoying this," with a wink and a laugh. And David said he was incredibly angry when he witnessed the incident, said, "I was standing there trying to learn, and this guy was being a dirtball." Asked that if he went along with the joke. He said he did pretend to laugh at the time, but he'd never been able. Said he'd never been. He then asked the teacher if he'd been in a similar situation, and the author admitted that he had been in a similar situation when he was a medical student. Recounted the story to his class, and he had helped to deliver a baby girl. The new mother started bleeding profusely, called for an obstetrician named Dr. Canby, and he came to attend the patient, said that the patient had uterine atony, and that the condition in which the muscles in the uterus do not contract properly after delivery and causes hemorrhaging. He put the patient under anesthesia. Dr. Canby placed his left hand inside and massaged the uterus. A procedure that could help it contract, and the woman did, and the bleeding stopped. And then he said something like, "Atta girl, that's what I like, a nice tight uterus." Then he did something he'll never forget, and Dr. Canby raised his right hand in the air and started singing La Cucaracha as he was dancing around. And, we had the story a while back about the guy that was, remember the one where the guy had started recording with his smartphone, and then it recorded the doctor calling him names and all kinds of stuff. Just makes you wonder what kind of stuff happens in the surgery room there when you're completely anesthetized and you're unaware of what's going on.
Oh, if you do have to have even emergency surgery, you want to have an advocate in that room to be your awake being, right? Somebody in there, because, some of these doctors perform oral sex on these patients who are under anesthesia. Really bad stuff. They should be put in jail for this sort of thing, but they all get a giggle out of it because the patient is helpless. And so if you do have to have a surgery, I wouldn't do certainly any elective surgery, but if you have to have emergency surgery, make sure that there's somebody from your family or a good friend is awake in that surgery room watching and making sure that everything's right. Because when you have total power like the medical profession, they've been since 1914 in the Flexner Report. They've been a protective monopoly, self-policing. They have no oversight by any agency. And, of course, these are terrible ethical things they do. But remember, Doug, according to the CDC, the Center for Disease Control, according to the Journal of the American Medical Association and the Institute of Medicine, medical doctors kill, injure, and infect 15 million of their patients each year in hospitals and clinics. They infect 2 million alone in hospitals, of which they kill 90,000. If a foreign country were to do that to us once, it'd be war. Well, here's one trade that does in the workplace every year. They don't even get an OSHA ticket. There's something wrong with this picture. Contact your young GV associate. Learn how to save yourself and stay away from the doctor as much as possible. Well, we'll be back with more truth, justice, and the longevity way on Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
Let's head to Vernon, British Columbia, and Tex, you're on with Dr. Wallach.
Hello, Tex, you're on the air.
Hi, Dr. Wallach. I've been sick every day for the last 20 years. I'm 69 now. I have been diagnosed with restless leg syndrome. That's incurable, apparently. And then went to depression, which is now they call refractory depression. I have anxiety disorder, massive headaches. Well, I don't know whether they're migraines, and tinnitus. I've been through 40, 50 different prescriptions. I've had electric shock therapy. I've been to neurologist, naturopath, and we're not getting anywhere. And currently now I'm taking methadone, Emilin, which is similar to your Ambien, and
Sure.
temazepam. And I do get some sleep, but I just feel awful the next day. And
Sure.
this
How much do you weigh?
How
much do you weigh, Tex?
About 162.
Okay. And do you have any history of any skin problems, any eczema, dermatitis, rosacea, acne as a kid, anything like that?
No, I didn't.
Okay. Do you have any respiratory problems, any asthma or bronchitis?
No.
Okay. What about bowel problems? Constipation, diarrhea, irritable bowel syndrome, diverticulitis, appendicitis?
No, I had my appendix removed, and 6 years ago I had my kidney removed for cancer.
Okay. And they removed your kidney for what reason?
Because it was cancerous.
The kidney. What about your appendix?
My appendix, they said I had a burst appendix back.
Okay, it ruptured. Okay. Okay, this is actually a Shar thing. As crazy as it sounds, Shar, what would you do for this fine gentleman?
Some problem, gluten-free diet, so he absorbs everything.
Okay. And you're breaking up, dear, so I don't know if you're on a cell phone or what, but...
I would give him 2 healthy brain and heart packs.
Okay. And let's see here. And because he's got some bone stuff and disc things, restless leg syndrome, his low back problems, and tinnitus, his osteoporosis of the skull, what would you throw in for that?
I would throw in the Ultimate Daily and glucogel.
Perfect. Okay. Char's exactly right. First of all, you got to get rid of all the bad stuff. Your doctors, and all these doctors you've gone to have missed it terribly. You have a gluten intolerance. This is why you've been sick almost your whole life here. And you have so many different problems. They're all nutritional deficiencies. So you need 2 healthy brain and heart packs, 1 full dose of everything twice a day. And then you need 15 glucogel a day. So you need 2 large bottles of glucogel, 5 at breakfast, 5 at lunch, 5 at dinner. And let's see here, I'd also take the de-stress capsules. Take 3 of those twice a day. It's 2 bottles a month. Get away from all the bad foods and call us every couple of weeks. You're going to be a new man. We'll be back after these messages.
Let's head to the Virgin Islands, and Emilin, you're on with Dr. Wallach.
Hello, Evelyn, you're on the air.
Hi, Dr. Wallach. Yes, I was calling because I'm trying my father out on the tangy tangerine, and he's also taken the Beyond Osteoflex and Selenium and the 3 essential EFA. But he's complaining that he's having diarrhea. It's his bowels are more loose, and sometimes he's having some abdominal pain, abdominal cramping. Is this something that happens?
Well, when you have somebody who hasn't taken supplements before, what I would do is just cut the dose in half, okay, and start him out slower. Instead of giving him a full dose, I would go ahead and cut the suggested dose in half, and that's where I would start. And in other words, give him a half a dose, but I'd divide that half dose into 2 quarter doses. In other words, give him a part of that half dose for breakfast and a part of the half dose for dinner time. So he's going to get a small amount for 2 meals, and then you go 2 weeks, and the discomfort and the diarrhea stops, which it will. Then you can get him to move up and take a half a dose or a quarter of a dose 3 times a day for a couple of weeks. And then no problems for a quarter of a dose 3 times a day, then move up to a half a dose twice a day. And so it's a process sometimes to move into something you've never done before. It's not unusual. You do something unusual. Like, for instance, if you go to a gym, you haven't been working out for years and years, you go to a gym, you're going to be sore for a week because you're using muscles you haven't used before. And so that's what I would do. It's a very simple thing. Just start out at a lower dose, split it up during the day. Don't take it all at once. And after a couple of weeks, then move up another 25%. And after a couple of weeks more, another 25%. And if no problem, which there shouldn't be, everything will be fine. Okay?
Very initiated. I'm trying to build him up. What can we use in your product line that can gain weight?
Oh, gain weight. How much does he weigh now?
He's 130, 125 pounds.
And how tall is he?
5'11".
Mm-hmm. Okay. 5'11". Yeah, he could use another 20 pounds or so, 25 pounds. What we do for athletes want to gain muscle is get our Slender FX, which is a weight loss product. It's a amino acid shake, and if you make it with water, it's a weight loss product. But if you make it with half and half or heavy whipping cream and throw 4 eggs in there, and he could have 2 servings of that a day. Whip it up, and he can freeze it and eat it as an ice cream, or put ice in there and make it as a cold shake. 2 servings of that a day. We have professional athletes and Olympic athletes and university athletes that take this to gain muscle mass for their sport. And so it's a way to gain healthy weight, not just fat, but gain muscle weight. Okay?
Okay, amino acid with 4 eggs in there.
Well, not an amino acid, our Slender Effect shake. Okay? It's a meal replacer. Okay, well, stick with us. We'll be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie for these messages.
Let's head to Pennsylvania. And Sal, you're on with Dr. Wallach.
Well, Sal, you're on the air.
Okay, Doc. I weigh 170 pounds. I'm 5'6", and I'm 84. Doc, I've been taking your products for many, many years, and I attribute my good health and my wife's health to your products. But all of a sudden, I had these problems. I've had diabetes for a while, and 2 months ago, I had an heart operation. I had 2 stents put in it. And of course, they want to put me on medication. I had an appointment with my doctor this morning. I told him I was not going to go with his program. He wasn't too happy about that. So
okay. Well, first of all, I'm sorry you had the stents put in, but we have to do 2 things. Shar, you there?
Yes, I'm here.
Oh. Okay. What causes the inflammation that cause blockages of the arteries? Is it cholesterol and saturated fat? What causes the inflammation that clogs your arteries where doctors want to put stents in?
No. It's canola oil and olive oil and salad dressing and stuff like that.
And microwave popcorn?
Yes.
Yeah, that little icing in the Oreo cookies, in between the 2 Oreo cookies, that kind of stuff is what clogs the arteries. So you have to stop all the bad stuff, Sal, okay? No fried foods, as Shar says, no fried foods, no processed meats with nitrates, nitrites, no oils. That means no olive oil, coconut oil, margarines, mayonnaise, salad dressings, cooking oils. Absolutely no gluten, no wheat, no barley, no rye, no oats. And he weighs 170 pounds, Shar. So we know he has vascular disease in the heart. The odds are he has some in the brain and the kidneys, in the eye, and every place else, because it doesn't just happen in the heart. But he's got diabetes here. So what would you give him? Diabetes, vascular disease?
Well, I'd give him 2 healthy blood sugar packs, but then in addition to that, he needs Ultimate Daily, Cardio Sticks, and Cardio FX to open up all those afferent arteries.
Okay, very good. Exactly right. So, Sal, we need you to get 2 healthy blood sugar packs per month. Take 3 sweeties at breakfast and dinner, 1 ounce of the Osteo at breakfast and dinner, 2 scoops of the Beyond Tangerine 2.0 NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner, all to be accomplished by the 2 healthy blood sugar packs. Okay, and I added 2 of the 3 of the EFAs twice a day, so you have to get 2 bottles of EFAs too. Also, that's to reduce the risk of obstructive thrombosis, blood clots, and taking the 3 sweeties twice a day with the healthy blood sugar packs what will happen is here the blood sugar is going to drop, so take your fasting blood sugar before you medicate yourself, and you should be able to wean yourself off of medication. Also, as Shar said, you want the Ultimate Daily tablets. Take 3 of those twice a day. That's 1 bottle a month. But also, as she said, throw in the Ultimate Cardio Sticks. Okay? The Ultimate Cardio Sticks, I want you to take 2 of those a day, 1 at breakfast, 1 at dinner time. Tear off the top, put the powder in 12, 14 ounces of water, shake it up real good, and drink that twice a day. So it'll be 2 boxes a month of the Ultimate Cardio Sticks. And I think that'll cover it. Okay, but staying away from the bad stuff is important. Oh, yeah, because you're diabetic, you need to stay away from carbohydrates and sugars per se, not only wheat, barley, rye, and oats. Okay, Doug, let's go to a caller.
All right, let's head to Tennessee. And Philip, you're on with Dr. Wallach.
Well, Philip, you're on the air.
Hi, Dr. Wallach. Hey, I had a quick question concerning my dad. He's 82. A couple of years ago, he had a tumor removed from his lung, and they kind of cut the lower lobe out, and then they gave him a dose of chemo, of course, around the chemo after that. He was doing okay the last couple of years. They said he developed hemochromatosis, which is too much iron, so they would actually, bleed him occasionally to get the iron down. But now they say he's kind of having a boomerang effect, and they diagnosed him with MDS, which is basically, they're saying the bone marrow is not producing enough blood cells, so he's getting kind of weak now. So, and I'm familiar with your programs, the longevity and also protein, the whey protein, and kind of a healthy lifestyle. It's kind of harder to get him to do that.
Okay, well, let me jump in here so we're sure to get this in. This is not unusual, and I'm going to kind of lay this out, and Char's going to tell you what to do for your dad. A guy who's 82 years old, if I got that age right, correct? 82 years old?
Yes.
Yeah. It's not unusual for them to have some form of osteopenia, osteoporosis, osteoarthritis. What happens is the bone matrix, the rebar, if you will, of the bones begins to fill up the bone marrow cavity and squeezes out the cells that make red blood cells, make the hemoglobin and make red blood cells. And so you tend to get more iron in the blood because it's not being used to make red blood cells or hemoglobin because the cells aren't working. And then they get anemic. And then instead of taking blood out, and then they would start giving them transfusions. The doctors are confused. Okay? And so basically, he has serious osteoporosis, which is causing his bone marrow cavity to be filled up with this tendon-like material called bone matrix, which is squeezing out the cells that make platelets, that make white blood cells, make red blood cells. So what would you do for this guy? Shar weighs, what does he weigh? Philip?
He was weighing about probably 175, 180. He's about down to 164 now.
Okay. So what'd you give this guy, Shar?
I would still give him 2. I would give him 2 healthy bone and joint packs. He's got to get rid of the arthritis, or the osteoporosis.
Okay, very good. And let's see here. He had a tumor in his lungs. What would you do to help his immune system?
Give him selenium.
Okay, sure. Let's give him 2 healthy brain and heart packs. Let's do it that way. It'll serve as give him what you want. 2 healthy brain and heart packs, a full dose of everything twice a day, including the selenium 3 twice a day. And then the glucogel, 2 large bottles of glucogel, so you can take 15 of those a day, 5 at breakfast, 5 at lunch, 5 at dinner. What would you give him to support stem cell activity to kind of regrow bone marrow?
I give him immortalium.
Very, very good. Yeah, get him 2 bottles a month, Philip. Have him take 3 immortalium twice a day. And it wouldn't hurt also for him to get 1 bottle a month of the, let's see here, 1 box a month of the Ultimate Cardio Sticks. So you can take 1 of those per day. I'd have him take that at lunchtime, tear off the top and put it in water. And that's going to give him a large auric point. That's going to get him over 100,000 auric points, and which is going to help fend off, and his immune system will, defend him against cancers and stuff like this, and support healing and maintenance and so on. That's the Ultimate Cardio Sticks. So 1 at noontime each day. That's 1 box a month. Okay, how much time we have here, Doug?
You got about 30 seconds before I roll the music.
Okay, well, I'm going to go ahead and take it and remind people they want to get a hold of my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the new DVD, Somebody Needs to Go to Jail, and the new CD, Public Enemy Number 1. These are an extension of the Dead Doctors Don't Lie book, DVD, and CD, And they don't replace it, but what they do is they reinforce everything we've said in Dead Doctors Don't Lie, but with all the newest information over the last 25 years, just actually supports everything we were saying 45 years ago. It's just an amazing series of the book, Epigenetics, the DVD, Somebody Needs to Go to Jail, and the CD, Public Enemy #1. And we'll be back with Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach, Trip Young Giving, 95 Crusade. And Doug, let's go to callers.
Let's head to Colorado. And Pete, you're on with Dr. Wallach.
Well, Pete, you're on the air.
Yes, I'm about 6'2" and I'm 170, and I have a dickens of a time gaining any weight.
Okay, so you want to gain some weight?
Yeah, well, I'd like to gain some muscle.
Okay. Do you have any other issues? Any high blood pressure, diabetes, or arthritis?
No, but I do have arthritis, particularly in the joints.
Okay, so some joint problem. Okay. All right. All right. Char, what would you do for this guy? He wants to gain some weight. So how would you do the weight gain thing for him? And how would we deal with the arthritis?
Well, for the arthritis, he needs 2 healthy bone and joint packs, and for gaining weight, he needs the whey shakes made with whipping cream and eggs. And that's good muscle fat.
Okay, very good. Yeah, we do this, Pete, with professional athletes and Olympic athletes and university athletes and people who just want to gain weight like yourself. It'd be 2 healthy bone and joint packs, okay? And that'll be 15 glucogel a day. 5 at breakfast, 5 at lunch, 5 at dinner. That's going to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. And as Shar said, regardless of what else you eat, I'd have you take 2 servings a day of our Slender Effects shake, meal replacer. We got vanilla or chocolate, and throw in 4 eggs in each one, so a total of 8 eggs a day. And make it with heavy whipping cream or half and half, whichever flips your switch. And if you want the chocolate to be even chocolatier, you can throw in our Cocoa Jevity liquid chocolate, throw a couple ounces of that in there, and put some ice in it, blend it up real good, and you can have that as a cold shake. Or if you prefer, you can freeze it and make an ice cream out of it and have 2 servings of ice cream a day, 1 serving after breakfast or between breakfast and lunch, another one between lunch and dinner or at dinner time or bedtime snack. Either one will work. And don't forget to eat sweet potatoes with butter and cinnamon. And, stay away from, again, all the bad stuff, fried foods, processed meats with nitrates, nitrites, no deli slices, no sandwich meats, no oils, no olive oil, coconut oil, margarine, mayonnaise, celery, cooking oils, no gluten, okay, no wheat, bread, or oats. If you want to gain some weight with grain, use rice, but don't forget the sweet potatoes and the butter and cinnamon, baked white potatoes with butter and cinnamon, very, very good. And call us every couple of weeks. Let us know what you weigh. Let us know how the joint thing is going. And we'll walk you through this. Seems pretty straightforward. And we get this request all the time, and we're able to satisfy people's wants on this one. Okay, Doug, how much time we have?
Just under 90 seconds.
90 seconds. Okay, Shar, it's been a while since you had a chance to pontificate a little bit here. So why don't you tell people why you haven't been to a doctor in 25 years? What have you done to keep yourself away from a doctor for 25 years?
Well, because I take the longevity supplements twice a day for 25 years now. I don't have a doctor. My gynecologist, I found out, died. He retired and then he died. But, the food is terrible today, and everybody kind of jokes about it, but it's really not a joking matter. That Roundup stops the plants from taking minerals up. So now we're really eating dead food. I mean, it's getting worse and worse instead of better, and people got to start to be alert about what's going on.
I have to tell people, Shar, that you're, 5'1"?
Something like that. I don't,
and about 95 pounds soaking wet, and she takes a 200-pound man's dose of the longevity supplements twice a day. So she's getting 400 pounds worth of dosage of our longevity products twice a day. And she takes the secret sauce for diabetes and fibromyalgia and high blood pressure and coronary artery disease and back problems and you name it, Alzheimer's disease. And so Char, earlier this year, turned 72 years old. Most people think she's 40 when you look at her because she does not have osteoporosis. Little old people look like little old people because they have osteoporosis of the face. You look at Char, and she looks like a 35 to 40-year-old cougar. She is there. And so thank you, ma'am, for sharing all that with everybody. Really proud of you. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order. PureWorks.
If you're up several times every night to go to the bathroom, have frequent urination during the day, feel like you have to urinate but then have difficulty getting a stream going, have leaking, dribbling, or urgency to the point a restroom must always be nearby, you may have an enlarged prostate. According to the National Kidney Foundation, by age 60, more than half of all men have an enlarged prostate, or BPH. By age 85, that number is 90%. According to the American Urological Association. Ultimate ProstFX from Longevity has been developed for nutritional support of the prostate gland. ProstFX promotes prostate health and supports healthy prostate function. Stop sprinting to the restroom and avoid those embarrassing moments with ProstFX from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate and don't forget to ask about home-based business opportunities.
In recent years, several studies have discovered the healthy benefits of drinking coffee. Longevity has now taken it a step further with an entire product line of healthy coffees from Longevity's JavaFit selection of top-shelf gourmet coffees. All JavaFit coffees are made from 100% premium, hand-selected Arabica coffee beans grown in the finest regions of Latin America. All are carefully roasted, creating a delicious, rich, full-bodied flavor. For an extra boost, try JavaFit's Energy Extreme 62, a proprietary blend of nutrients including cambogia, green tea extract, an extra shot of caffeine, and niacin, designed to support metabolism and enhance physical performance. Available in single cup or single pot packs. Contact your local Longevity distributor to get Jovolution coffees. And don't forget to ask about the home-based business opportunity.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the ultimate tangy tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables. And besides that, they're not as good as tangy tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.